I'll just start by welcoming everyone back to our virtual press conference. A minor change this week. We're going to start with opening remarks from our infectious disease specialists, Dr. Thompson from St. Luke's and Dr. Prabhu from Essentia. And then we'll get a brief word from Dr. Van Dielen, the Chief Medical Officer at St. Luke's. After that, of course, we'll go to questions. And as a reminder, Dr. Pryor, president of Essentia's East Market, is back with us again as well. Those questions can be asked via the raise your hand function and then waiting to be called on, or you can submit them in the Q&A feature, and that button is at the bottom of your screen. And we'll do our best to answer as many questions as possible. And just a reminder, if you do ask a question, please say your name, the media outlet you're with, and then to whom your question is directed. We've been doing about 45 minutes, and so far that time frame has worked well. So we'll shoot for that again. And with that, I will turn it over to Dr. Thompson.
Well, thank you, everyone. I think this is a good week to have the infectious disease representatives front and center here because recently testing has become a very hot topic. We at St. Luke's really welcome the ambitious goal that the governor set out yesterday to increase our testing capacity in the state. And I know the stated goal of 20,000 tests per day for active disease is a significant departure from what we've had recently. But I think this is a critical step that we need to take in order to better understand transmission and control the spread of disease. So the increased capacity that Hennepin Health and Mayo and the University of Minnesota now have in their labs is a really important advance. I think it's important to remember, though, that that is one big piece of what we need, but it's not everything. In addition, we need to recognize that we need the ability to collect swabs from patients and make sure that there's no shortage of swab collection. And following a potential positive test, there's also a lot of work that needs to be done to contact trace, that is, identify the ill person and other people that they may have come into contact with to determine if they might benefit from testing as well. So increased testing is wonderful and it's a headline, but there's a lot of work that needs to go into that after we have the ability to run the tests in a lab. A positive test in an outpatient, otherwise well person that's not admitted to the hospital must be followed by a period of self-isolation for at least 7 days or for 3 days beyond the time when their symptoms resolve, whichever is longer. And that's the critical piece that we, in general, need to remember. One other topic that has come up is what's the benefit of serology, or blood testing for an antibody? So that type of test determines if someone has been exposed to and recovered from COVID-19. Serology testing is very useful on a population basis, but it has some limitations when we think about it on an individual basis. For instance, any test has a rate of false positives and false negatives. And even when it's a good test, when there's a low prevalence of disease in the community, which is what we have right now, there will potentially be more false positives than true positives. That could indicate to someone that they have a positive test and they consider themselves immune, when in reality that test isn't accurate. So that statistical concept is sometimes hard to understand. We always want to believe that a test is accurate and true. But on an individual basis, we have to remember that there are some limitations to that blood testing. And I would caution policymakers against using that sort of idea of a passport that once you test positive for having had the disease, you're all clear and ready to go. So I think there's more work that needs to be done and more research that has to inform our policy decisions going forward. So that said, St. Luke's is committed to following the guidelines put forth by the Minnesota Department of Health, and we will be expanding our testing criteria consistent with their guidance. So at this point, symptomatic individuals can access either our e-visit line, e-visit site on our website, or call our nurse hotline at 249-4200 to help guide them through the process if they're concerned about having COVID. And we do have a respiratory clinic at our Miller Creek site, which is open for business. And right now, that's where we're designating testing to be done. Symptoms of COVID-19 include fever, cough, and shortness of breath. Those are the most commonly identified symptoms. But sometimes people will also have muscle aches, headache, sore throat, diarrhea, or even loss of taste or smell. So those are the symptoms which should guide further testing. That's what I wanted to say about testing today. And at this point, I turn it over to Dr. Prabhu.
Thank you, Dr. Thompson. We've shared the similar comments, but I'll just go ahead. And so my name is Rajesh Prabhu. I'm an infectious disease physician at Essentia Health. And what we wanted to do today is to update you on the status of testing for COVID-19, both our approach and our current capabilities. As you've already heard by now, Minnesota Governor Walz has rolled out a new strategy for testing that involves testing all people who have symptoms that suggest COVID-19. And I'll just reiterate what Dr. Thompson had said about the major symptoms to look out for, and it could be any of these symptoms: fever, cough, shortness of breath, sore throat, headache, body aches, and diarrhea. And I wanted to let you know that Essentia Health and St. Luke's did collaborate with all the major healthcare systems, the Department of Health, and the governor's office in developing this new strategy for testing. And to kind of summarize, in this past week, Minnesota on average has been doing 1,300 tests per day. And based on analysis of the testing capabilities across the state, which includes the Mayo Clinic and the University of Minnesota, the governor announced a goal to test up to 20,000 people a day, as Dr. Thompson had alluded to. But I want to emphasize this is the capacity to test up to 20,000 people a day. At this point, the major focus will be testing symptomatic individuals only. But the good news on this is that with expanded testing, we will shortly get a sense of how many people have symptomatic infection in Minnesota and our surrounding service region, including Wisconsin. As Dr. Thompson had mentioned, that every infected person will be required to stay home at least 7 days, including 3 days without fever. And what this does, it helps prevent the further spread of the virus in the community. And as Dr. Thompson also said, you've probably heard the concept of contact tracing. And I'll just reemphasize, this means that public health will contact an infected individual and determine who they live with and identify close contacts outside of the household as well. Those people will be contacted and requested to self-quarantine at home for 14 days and monitor for symptoms. And if symptoms develop, will be tested for COVID-19. This is another measure to help prevent the spread of the virus. Also, I want to emphasize that masking in public, where you may be in close contact with others, even if you feel well, also helps reduce the spread of the virus. As you've heard, people can spread the virus before symptoms develop. On average, it's about 2 days before symptom onset. This is another important way to contain the pandemic. All these measures will help us flatten the curve and prevent the spread of this infection. So how do you get tested if you feel you have symptoms suggestive of COVID-19? At Essentia Health, the process remains the same. To start the process, go to essentiahealth.org to start an e-visit, and a provider will evaluate your symptoms and give you further direction if testing is indicated. For those who like to call to start the process, call 1-833-494-0836, and one of our nurses will help. There is no cost to the e-visit. At Essentia, we have designated sites or partnered with local hospitals across the region to offer testing. In the near term, we are confident that we have enough testing supplies to test all symptomatic people. We have a dedicated team in supply chain and lab that closely tracks our supplies in real time. The state is also working in procuring necessary testing supplies. We will continue to collaborate with St. Luke's and surrounding health systems in serving our communities. And kind of a last note, we continue to need homemade cloth masks for our staff and patients. We're very grateful to the community's generosity. Masks can be dropped off at our Miller Health Plaza in the former Yonkers building. We still encourage people to bring their own masks when they come to our facilities, either as a patient or for visitation. And if you don't have one, we will supply one. Thank you.
Thank you, Dr. Prabhu. I think Dr. Van Deelen has a few words for us as well.
Thanks, Louis. Thanks, Dr. Prabhu and Dr. Thompson. It's so great that our region has such a high level of expertise to help us understand this very complex problem. I just want to talk a little bit about kind of the rest of the lay of the land healthcare-wise, both regionally and at St. Luke's. So our volume remains low in regards to COVID-19. And that's true in the hospital at St. Luke's as well. We've delayed many non-essential healthcare visits starting in mid-March. And we could delay that because the surge of patients has been delayed. And that's really a credit to all the hard work you've been doing at home. So we've been actively preparing and really feel prepared for the surge of patients that's to come. That's been fantastic. However, we know that many people who could delay a visit to their healthcare provider starting way back in mid-March can no longer wait another month or 2 or 3 to be seen. Both institutions have done a great job at advancing telehealth during this time, and that's been really exciting to witness. The problem is that those visits, although they're great for many things, they're not perfect for everybody, and sometimes individuals struggle with technology or really just comfort with that type of a visit. So we know people still need to be seen in our clinics, and we want to reassure you that our clinics are open, ready, and able to care for you. In an effort to ensure that our patients get the care they need, we have implemented robust safety measures. Only the patient is allowed in our buildings, unless the patient is underage and requires assistance either for mobility or communication. We're striving to have every patient register and wait in their cars and then go straight to an exam room. For those who have to wait in the waiting rooms, our waiting rooms have been reconfigured to maintain appropriate social distancing. We require all staff and patients, as well as the visitors who are allowed, to wear masks. And we're doing extensive cleaning after each patient visit. With these measures in place, we can provide patients the important care they need in a safe environment. Specific types of visits that we think are really important to continue include immunization and well child visits, annual wellness exams, preventative cancer screening, chronic disease management, and visits regarding anxiety and depression. We also want you to know that routine outpatient imaging exams are being scheduled again. Many of these are very important for following chronic health conditions. So mammograms, CT scans, MRIs, and ultrasounds are available, and the same safety measures have been put in place for those. St. Luke's is also encouraging parents to continue to bring their children in for key visits and vaccinations. It's important for kids to stay up to date on their childhood vaccinations to prevent outbreaks for diseases like measles and whooping cough. This area has struggled with these preventable diseases in the recent past. Having all children continue their vaccinations helps lower the possibility of another outbreak of these diseases locally. The exam that occurs with those vaccinations is just as important. especially for children under age 2. Infancy to age 2 years represents a time of vital speech, motor, and emotional development. We closely track growth to ensure young minds can grow well. And then finally, as I mentioned last week, we want to reemphasize, if you have a medical emergency, please call 911. Just as in our clinics, we have robust safety measures in place to make sure that our emergency departments are safe and ready to care for people with all types of illness and injuries. Thanks.
Thank you, Dr. Van Deelen. And now we will open it up to reporter questions. I'm going to start with a question submitted by a viewer, if I can find it real quick. And this likely would be for both hospitals. Can you give any kind of indication as to when elective surgeries might start up again? The question talks about people being in pain and needing surgery. Any indication when that might happen?
I can start. So I think there's an executive order for Governor Walz not to do elective surgery. And the reason is primarily the preservation of PPE, which is important for the protection of our staff as well as the patient. I know that this has been a hardship for a lot of people who feel like what was elective several weeks ago at this point is not elective anymore, and that they need the surgery or really desire it. I think Governor Walz, from what I understand, he's listening to these concerns, and he's working with the Minnesota Hospital Association to decide when is the best time to basically rescind or alter that executive order and allow these surgeries to occur. Based on what's happening in other states and based on the conversations that I've heard, I suspect it's going to be sometime in the near future, but I think we all need to maintain patience, to make sure that it's done in a safe manner.
I can just add, St. Luke's is following the governor's guidance as well. We do continue to do surgeries that are considered to be non-elective, and we review those cases daily. We are actively working on developing a process for, once the order is lifted, how to move forward with surgeries and make sure that we're getting those individuals who need to be cared for more urgently at the front of the queue. So we're all actively involved in the process of discussing this, but it has to be done in a manner that's safe and that assures us that we have enough of the critical equipment and medications available to care for the surge that may be to come.
And I could build on that just a little bit further, and I'm sure it's the same at St. Luke's. I think it's probably the same at most health systems. So everyone, for the most part, is doing emergent and urgent surgery, but there's this category of time-sensitive surgery. So it's things like cancer, for instance, where at some point time is a factor and you need to do the surgery. So we are doing those types of surgeries when it's clear that the risk of not doing the surgery is greater than the risk of getting COVID. So again, cancer is a great example of these time-sensitive surgeries that I think a lot of health systems are addressing.
We'll go to Mr. Tom Olson from the Duluth News Tribune.
All right, thanks. Louis just asked probably my first question, so I'll go on to my second, which I guess might be for Dr. Thompson or Dr. Prabhu. I guess we've heard a lot, about the different kind of modeling and projections of, when we might see a peak use in resources or hospitalizations or deaths. And I guess there are a lot of different numbers out there people kind of see being thrown around, and it sounds like we are doing a good job of pushing that date back. But I'm wondering if there is a sense of what we're preparing for, if we kind of have a date or a time period in mind of when we might actually see the peak here in the Northland area.
Well, since no one else is jumping on, I'll jump on. I have actually been following the models very closely. I've been working on the Minnesota, working with a group that's been working on the Minnesota model, which is done by a corporation called Covin, and there's 9 health systems that have been participating in that endeavor. It's amazing to me how when you change the inputs, you change when the peak's going to occur and how big the peak is. So they can show on this model that if you have good social distancing, you flatten the curve and it delays when it's going to happen. And when you don't have good social distancing, the peak gets higher and it moves closer to where we are today. So I think that what happens in terms of when we're going to get a surge, when we're going to see a peak, really depends on how good we are doing at social distancing, how thoughtful we are when we loosen up these stay-at-home executive orders from Governor Walz. I know that he's being extremely thoughtful about it. He wants it's a balance of trying to get the economy back, but at the same time keeping Minnesotans safe. And he's trying to find that sweet spot. And he's listening to a lot of experts on this. But that will obviously affect when it happens. If I don't want to give an exact. No one knows exactly when it's going to happen. I think most people think in Minnesota sometime midsummer. But again, that could be moved up or moved back into the fall, depending on what happens with social isolation. So Minnesota, we're doing a great job staying away from each other, wearing masks, staying at home, things like that. Let's continue to do that.
Let me add on to Dr. Pryor's comments. I think the great thing is that now that we're testing all symptomatic patients, that gives us the opportunity to really, quote, flatten that curve or reduce the number of people that are infected in the community. And so those projections of what will happen in the future will change certainly with this intervention.
And I would also add that more input, so more data on active infections will also help the model be more accurate. So as we move forward, the important thing with modeling is to refresh it when you get new information also. So over the next few weeks, it may become more clear. But again, I would agree with Dr. Pryor, it's looking possibly like midsummer. But the further out you try to predict, the harder it gets. It's like the weather.
I have a question from Leanne, who asked, just to reiterate, how achievable is the 20,000 tests per day goal? Is it revolutionary? And also, finally, when will people be able to get that testing done? When will that start?
I'm going to go, this is Dr. Prabhu. So it would start today at Essentia. And remember that 20,000 is 20,000 capacity. Meaning that we were in discussion with all the health systems what their capacity to test is, and it certainly will be potentially go to that. It doesn't mean there's 20,000 symptomatic people right now in the state. And on average, so far the people we've tested, about 3.6% of people have been positive for COVID-19. So we've tested in this region about 1,800 people so far, and 3.6% are positive.
The same is true at St. Luke's. Testing, like I mentioned, has been expanded to include symptomatic people in general. We do maintain the priority for people at higher risk, but anyone with symptoms would meet criteria for testing. I think that 20,000 number is an aspirational goal. I don't think we're going to run that many tests today. No one expects that. But the ability for the labs to run that many tests in a day is what the goal is.
I think a question kind of along the same lines from Brett, who asked for both hospitals again. Many tests, as you guys have alluded to, are coming back negative throughout the state. And so the question is, are folks getting tested out of fear or confusion with the symptoms? How accurate are COVID-19 test results?
And Dr. Prabhu, so we are only testing symptomatic people, and what makes this infection very tricky is that it mimics other viral illnesses. So you talk about fever, cough, sore throat. Those are, at least the sore throat is many people experience those symptoms. Even diarrhea is thrown onto the list, but because this virus can affect different organs. So that's why it's important to call ahead and talk to your provider to see if your symptoms are compatible. The good thing is that there's now no limitation. If you're symptomatic, we will be able to test you.
We think that the test that's currently most commonly offered, which is a nasal swab looking for genetic material from the virus, is a very sensitive test. We think if people, right around the time of the onset of their symptoms, we think this will pick up most infections. But like Dr. Prabhu said, a lot of the symptoms are non-specific. Many different conditions or illnesses could cause similar symptoms. It's not surprising, I think, right now that the rate of positive infections is fairly low.
And I would just add that even if you have an illness and your test is negative, you should still follow the similar measures, meaning don't go out when you're sick, mask, stay home until you're well.
We'll go to a question from Renee.
Hello, thank you. I'm wondering if you want people who've been turned down to get the test because they didn't fall into the categories before. Do you want them to call again and try to get tested now?
Yeah, Andrew Thompson, it really depends on what symptoms people are having today. And I think that might be a good time to do an e-visit or call our nurse hotline to describe the situation, describe what kind of symptoms a person is having today. Because if you were sick last week and didn't get tested, and you've appropriately self-isolated and are feeling better, there's no benefit to getting a test today. But if symptoms persist and you need further medical attention, that would be a good time to schedule an e-visit or a telehealth or a nurse hotline call.
I'll go to a question from Dan as a follow-up on social distancing for Dr. Pryor or anybody else, but could you explain more directly why it's so important that we continue to do a good job of this social distancing? People are naturally getting frustrated with the longer this goes on, and why should they continue to be diligent in terms of distancing?
Sure. While it's possible that people can get the virus, SARS-CoV-2, which causes COVID-19, from touching surfaces, the biggest way that they get it is transmission of respiratory particles, air droplets. And so it's transmission through the air, basically. And they've shown that a minimum of 6 feet distance from you should, in virtually every case, prevent that. There's some evidence, obviously, and it makes sense also, that farther is even better. This is why we're encouraging people also to wear face masks, like scarves, when they go outside, because if they do sneeze, if they do cough, it may go farther than 6 feet, but hopefully the scarf will prevent those droplets from doing that. We do know from scientific studies that the viral particles basically at most last about 30 minutes in the air, and then they disintegrate. So that's why it's important to just keep that distance. Don't get in the same elevator with somebody else, and wear masks when you go out. Especially be careful at grocery stores. We all need to go there to get food. I understand that, unless it's dropped off at your home. So I think that, again, I said before, we've done a really good job of this. I know that summer's coming. People are getting antsy and they want to get outside, but this is a life or death matter. And I think we need to show our grit here, and until there's a vaccine, we just need to stay away from each other, a minimum of 6 feet, and wear masks whenever we can.
Hey, Dr. Pryor, I just want to build on Dr. Pryor's comments. I mean, though we're rolling out testing for all people that are symptomatic, the same measures we've been doing in the past, social distancing, cleaning your hands, face masks in public, are all very important in trying to mitigate, contain this pandemic. So it's a multi-pronged approach, and we cannot let up on those other sort of interventions, I guess, because we're expanding testing across the state. And to emphasize, I mean, if it truly says that, you know, only 3.6% test positive, that's maybe good. And if it's a lower number in the future, that means our measures are working. Meaning, if we stop those social distancing measures and say open up the economy, open all the business, and go back to normal, you'll see positivity rates are 10, 20, 30, 40, 50, 60%, and we don't want to get there. If we get there, that means the curve has not been flattened.
Got a question from Tom Olson.
Yeah, and I guess I don't know all the specifics of this, but I know Congress is passing another spending bill today, it looks like, and I believe it includes something like $75 billion in relief for hospitals. And I guess I'm just wondering if that's something that Essentia and St. Luke's are anticipating being able to benefit from, or just kind of what is the financial state of affairs right now, and are you anticipating you know, some relief in that area there?
So I can speak from the St. Luke side. I'm sure Dr. Pryor will feel similarly. This is an extremely challenging time for healthcare in general, and St. Luke's is certainly consistent in that. Again, with not being able to perform procedures, and with the great job people have been doing social distancing and staying home, our volumes are down across the board. So it's challenging based on our usual revenue sources. That being said, there have been a series of measures, both at the state and federal level, that we have worked very hard to apply for assistance through, whether that's in grants or loans, and we've been successful, and we've been very appreciative of that help. And again, this most recent measure, we have applied for some assistance through there, and yet it's a small piece of the puzzle, I'm afraid.
Yes, I would say, I would echo that. Our volumes are down, and I think at our institution, and what the number that I hear most commonly at most institutions is volumes are down around 40, 45%. Expenses are up because it costs money to prepare for the surge, to buy this extra PPE, to buy vents, and so costs are up. And in healthcare systems that typically have margins around 2 or 3%, obviously that creates a significant problem. And the data from a survey from the Minnesota Hospital Association suggests that Minnesota hospitals are losing in total around $1 billion a month. So you can do the math and approximately figure out what each system is losing around. So this is not sustainable, and therefore we are extremely grateful for any help that we get. We've gotten some help from the state level, and we're very grateful for that. And we're grateful for the support that we get federally. So the 75 million or 75 billion that was just appropriated, we will apply for some of that. We expect and look forward to getting it and need it and are grateful for it. But let me just say, it's not enough. I think every health system is struggling deeply right now. but we're doing the right thing. None of us wanted to be here, and it's not just the hospital systems. We clearly recognize that the economy in general is struggling, and we're all in this together. And we're going to get out of it together.
Question from Leanne. Dr. Thompson said there's still a lot of work to be done aside from the testing, and can you go into more detail on that?
Yeah, what I was getting at with that is a test alone isn't enough, in the sense that what we really need is contact tracing. When someone has a positive test, what we need is public health folks who normally do this job to call that patient, find out who they've been around, who lives in their household, is anyone else sick there, do they also need a test? So that's the other end of the lab capacity to actually perform the test. We actually have to act on the results if we're going to limit transmission. And so that, I don't want that to get lost in the, like I mentioned, the headline of a number of tests that we can do. That certainly matters, but there's also a lot of shoe leather epidemiology to be done in finding those other cases.
Brett asks about the Red Cross. Nationally, the Red Cross has been taking plasma donations from patients who have recovered to help those currently battling the virus. Should Northland residents who have had the virus look into doing this locally?
Want to go, Dr. Thompson?
Go ahead.
Oh, so we are looking into that. Hopefully, we'll have a process in place. It's called convalescent plasma to help treat COVID-19. And we are collaborating. I believe Mayo Clinic is sort of a center repository for that. So we anticipate doing that in the future. Certainly, we need people that have had, and the benefit of testing more people is that now we know, there's more people that are eligible if they're willing to donate plasma for this project for therapies.
I'll go to a question from a viewer who asks, are we doing antibody testing here yet? If so, what's the criteria and how do I get a test?
We are performing limited antibody testing here at St. Luke's. We send our specimens to the Mayo lab to be done there. It's really not clear right now what the criteria are, who should get an antibody test, and what the result means. So I am, it's hard for me to give guidance, and I'm sort of reluctant about promoting it because right now, like I said before, with a low prevalence of disease, if we only have a few percent of the population that's been infected, testing on an individual basis is not very accurate. It can't reliably tell you if you've had the disease or if you haven't had the disease. It works better on a population level when we have many thousands of people who we can test. It helps us understand disease prevalence and transmission. So in answer to the question, it is available, but I don't know what to tell you about the benefit of the test.
Dr. Preble, I'll just expand on that. So there's two testing modalities. One is that PCR test, and that's going to be the primary way that we actually diagnose people with COVID-19 infection. So if you're having symptoms currently, that is the best test available. The issue with the serology is that it can diagnose you of having recent or past infection, but the sensitivity doesn't really ramp up to closer to, high 90s, close to 100% until 2 weeks into your illness. And we want to diagnose you before that. So there may be a role in the future, but for people that are being admitted to the hospital, I think it's a minimal role.
We'll go to a question from Renee.
Thank you. In light of the low volume right now, which is good, is there any chance of making a policy change to allow family members to visit patients who may be at the end of life? Not necessarily because of COVID-19, but because of other hospitalization problems.
So, Dr. Prabhu, so we do have a policy in place for end of life care for visitors. And it's usually 2 visitors in like a 24-hour period. And the purpose of that is to try to really limit introduction of infections such as COVID-19 into the hospital, because that's a setting where there's a lot of vulnerable people, healthcare workers, and we don't want that to get entrenched in the hospital.
Yeah, I would just add to what Dr. Prabhu said. We do have a policy that allows for visitation of individuals near end of life and when other special circumstances come up.
And the other point to add is we do have some other novel ways in terms of video visits. So for more people to have sort of at least visual contact with their loved one as well.
I don't see any other hands up. We do. Maybe we'll go to one more question from a viewer. And this one says the University of Oxford started a vaccine trial today. Do you have any hopes that this vaccine will work?
Lots of hope.
I think there are many vaccine candidates and trials that are in the works, and again, I'll second that. We have hope.
And I guess the thing that the benefit of that is, I think a lot of experts around the world feel that this is not going to be a one and done thing with COVID-19, that you may have other sort of resurgence in the fall, etc. So hopefully we'll be better prepared with a vaccine that works at that time.
I think it's important to remember in regards to development of a vaccine that we're really looking at a year on the short side to the development of a vaccine, and that is lightning quick for vaccine development. Fast vaccine development up until recently was 4 to 5 years. So I think it's just important that people understand the timeline, and that has everything to do with when you develop a vaccine, you then need to go through a whole series of very specific tests to make sure that it's safe, that it actually produces meaningful immunity. I guess I just think it's important that individuals understand the timeline that we're talking about.
And then actually, once you have your vaccine and you've done your trial and you've shown it's safe and you've shown that it's effective, the manufacturing process for vaccines tend to be very complicated. And to make a vaccine for the 300 million people plus in America, and then when you look at across the world, because we are in this global community, it's not just about us in the United States. I mean, you need big factories, and that manufacturing process is going to take a while to get ready. So again, I point out that I'm excited the trial started. There's probably going to be a lot more trials that happen. I heard at one point that there were up to 70 vaccines somewhere in the pipeline being looked at or prepared or being worked on, but a certain amount of patience and grit is going to be necessary here.
We'll do one more question. Renee?
Thank you. Because the volume is low, which is great, some people do not believe that we will get a surge or that it will get worse because we're doing such a good job at social distancing. Is there any chance that we will not get a big surge, or that maybe we've already seen the most?
I am not, I mean, I've been following these models closely. I understand them well, but I'm not an epidemiologist, so I feel somewhat ill-equipped to answer this. But it continues to go up, so we have not hit the peak yet. What that peak is, I think, is going to be dependent again, on the social distancing, on the testing and the contact tracing that's been discussed today. And so the best thing that could happen is we do a great job with the testing on symptomatic patients and contact tracing. We keep the social distancing, and you see at some point it does peak and people say, hey, that wasn't any big deal. And that would be a win. The worst thing we could do is just assume that, oh, this isn't, none of this is important, and hundreds, if not more, lives are lost. So let's just value life. Life's wonderful, value each other, and do the right thing here, and not assume that there's not going to be a peak, and take the precautions that we've talked about throughout this press conference.
Dr. Thompson, did you have comments?
I did, but I agreed with everything Dr. Pryor said. I think the current status here is reflective of what we've been doing in recent weeks. We're a susceptible population, so most people in our region are still susceptible to this virus. So if we stopped everything today and completely opened up, we would most certainly see a huge surge. So we're trying the best we can, I think, and on a statewide level to find that right balance and thread the needle to keep as many people safe and to keep going.
Yeah, I'll just add some comments on that. I mean, so the surge thing, I mean, every intervention we're doing is the reason at this point we have a low positivity rate. So, I mean, you've probably heard on national TV, if we stopped social distancing, if we just open up all the business as usual, we'll become like other parts of the world, will have inundated with cases. And in a pandemic situation, it's always better to be over-prepared than under-prepared.
Yeah, I think, we're all united in that belief and exactly what Dr. Pryor said. I think it's important for us not to develop complacency and to understand that the disease prevalence that we have is a direct function of the great work that our state has done. And that has already saved hundreds to thousands of lives. So, and we know it's difficult, and we feel it in our own healthcare sector, and we know so many of our fellow business leaders are struggling, and we look forward to, as Dr. Thompson said, trying to figure out how to thread the needle, how to really foster some reinvigorated economic activity. But at the end of the day, we're talking about human lives. And that's why I think we have to be very, very careful. And we are. And the results are great.
I think it's worthwhile actually thanking the leadership of the legislature and Governor Walz, and also organizations like Minnesota Hospital Association, which have really done a great job in working together as a group and leading Minnesota to such great results in terms of flattening the curve and keeping us safe and having a low prevalence rate. And thanks to the citizens of Minnesotans, us Minnesotans working hard together to stay away from each other. So again, let's just keep it up. Good job.
I think with that, we will wrap up today's press conference. Again, thank you everybody for participating and joining us this week. Thanks as well to the doctors for making time for this thing. We think it's a valuable tool and a resource for our community. So thank you to everyone, and we will see you again at the same time next week.